start off if anybody has some questions for the folks who are up here already.
Not sure how I can turn this on. It's on? Okay. I had a question and maybe, well, I'm not sure. So how much in the assessment of the cost of the package do you consider the mix of foods that might be appropriate for, or might be used by a low-income household as opposed to the general? So when you're weighting the food, the CPI food, let's say, using it in projections, or some other studies, how is that? How do you consider that, and how important do you think that is? Somewhat related is the projections of composites that USDA is using, things like the dried beans and whatever. If the composition of that group of foods were to change over time, is that something that you are looking at?
To answer part of your question, the study that I mentioned, looking at the California WIC packages, I don't think it broke it out by the type of household. It was looking at just a composite of all the households within California. I don't know if you had anything else.
I'm not sure if your question was directed at the estimating the cost for the impact analysis, but it is important, obviously, to include prices paid by, as best we can estimate, by WIC clients. And what we've done with the panel data is to use the income information on that data set to look only at the purchases by low-income households. Now, the economists on the panel might argue that prices paid by low-income households may not make sense if WIC clients are not sensitive to price. But what we found from our national survey of WIC participants is a USDA study is that WIC clients generally purchase their WIC foods from the same place they buy all their groceries. So to the extent that they are shopping in high price stores, low price stores, we don't have to make that decision. We just look at the data of households with income profiles comparable to WIC clients and see what prices they paid. You asked too about projections for composites changes in, I'm not sure I got exactly what you meant, but our impact analyses are very detailed to the point of, well, very detailed to the point where we look at the relative consumption of dried beans versus canned beans. We can't say for sure how the price data looking backwards is going to hold up going forward, but it's the best we have. But we do look at that by subcomponent.
Hi, Rachel Johnson. I have a question for Victor. So I was stunned by the amount of the rebate and the percent, and I just wondered if you could comment on how much cost shifting you think is, obviously there must be cost shifting to the non-WIC formula buyer, and then how much that's going to play into the rebates to the extent that the market will bear that price that the full price paying. I think of it sort of, the analogy is our university, which is a state university, and our in-state tuition doesn't cover the cost, so our out-of-state students are actually subsidizing our in-state, and to the extent that the market will bear that, and we're probably reaching a tipping point on that. Could you just comment on?
If I understand your question, I have not looked into that. In fact, I believe one of your panel members, David Davis, has conducted research on that very issue. And I think his conclusion was that it does not. Am I right, David? Yeah. If David Davis right here. Yeah. Okay.
And he agreed. He agreed. So I have a question about redemption, and it was news to me in studying the cash value voucher just how many of them weren't redeemed, since I would think this would be a real prize for WIC participants. And this is a question both for understanding the program and for the regulatory impact analysis. It seems from what you've been telling us that redemption varies. Not only is it less than we hoped for the cash value voucher, but it varies between the paper vouchers and the electronic benefit card. It varies by the type of client. It varies by the local area or the stores in some way. What's the committee to do with that information, and how can we use it, but also how can we estimate it? Is there a source of information that would really help us understand this?
Well, as far as the impact analysis, I know this is not your primary concern, but we've relied on some pretty limited studies, and because the estimates from the studies are both separated by a great span of time and also in method and in findings, this is something that we've discussed in the uncertainties to the estimate. So we've estimated the redemption under different alternatives and priced them out both ways, or multiple ways.
Hi, Catherine Ross. I'm going to take a stab going way out of my comfort zone. So on one of the slides, and I think it was yours, Dr. Harper, you mentioned food costs and administrative costs. And so we learned quite a bit about the food costs today, but I'm trying to understand the administrative side and to what extent we need to know that or work with it. So does administrative cost include the cost of the staff who are providing education to the participants? And, you know, what is the balance between this? Like if we changed the food package and that would require changes in education, how do you deal with those differences? Or must we?
No, well, to make it easier for you, I would refer you to the impact analyses that we've done. We've spent very little time relative to the food cost piece on the administrative side. But you're right, the things that you've raised are the key components. One example from the final rule is the relaxation on the need for a doctor's note for soy or tofu prescriptions for children as a milk substitute. That should reduce administrative costs to the extent that sort of middle step at the certification process or the process of prescribing foods is taken away. We've largely said that because WIC funds states for both food and for administrative costs, that any reasonably minor changes in administrative costs are essentially contained within the grant that they receive now, and it wouldn't impact the net federal expenditure on the program. Essentially the simplification we've made. But we do discuss them sort of in qualitative terms, that we just recognize and point out where the key administrative costs might be.
So should we be concerned with small changes or predicted changes in food costs? Are they just basically in the background, or are they? I'm trying to understand how significant they are as compared to the total costs.
Not sure exactly what you mean. Small changes in food costs. I mean, we try to address each provision of the rule and cost out the effect. In some cases, we conclude that the costs are minimal for some changes, but we describe how we got to the conclusion that they're minimal, essentially looking at the data to conclude that estimating the cost is something that would be below our ability to put any bounds around it.
We do look at changes in food prices. If it's about 2.5%, that's pretty average year over year. So anything higher than that would be something that's above average and might have a different effect.
So when you talked about differences in the percent changes by year by food group, that's really just informational background, or do you use that in some manner for the WIC package?
This was just some informational background.
Okay, thank you.
So I had a question, sort of in hearing about the different data sets, with the exception of Tatiana's study. I didn't hear a lot about, what makes stores decide to participate, and, burden on stores, or sources of data for burden on stores. Is there something else that we might not think of on our own that we should be? I mean, obviously we can go and look at what you did last time, but, is there something that you guys know about that we just wouldn't even think of?
For our impact analyses, we haven't ever tried to estimate the impact of the burden on stores.
Wonderful.
I mean, again, it
I'm
can be
sure we're all
acknowledged.
thrilled to hear that.
Well, acknowledged, but not priced out.
Right, okay.
I mean, there's the qualitative component to the impact analysis, and I don't have anything to offer there.
I'm going to continue in that vein. I'm going to ask another question I probably can't answer. I've read some of the regulatory impact work in the previous rules. And you did mention trying to quantify benefits. And can you speak to that a little bit? How did you quantify benefits rather than just qualitatively describing the expected benefits?
Well, first let me just ask you a question. Like I said, the impact analyses are actually hidden in these documents. You may have read the summary. The impact analysis itself is usually penned at the back. But assuming you've seen the full impact analysis, you'll see that our discussion of benefits stays very clear of quantifying any effects, either on health outcomes or long-term costs, medical costs. We have limited that discussion to very much referring back to the goals of the dietary guidelines and the IOM recommendations.
Okay.
Well, first off, great presentations, but a question and maybe a suggestion is, if you're looking at substituting or changing or reducing the quantity of one product, like maybe reducing milk.
We love you, Stan, but we're not allowed to have you ask a question.
Oh.
Would you like to come and ask a few questions?
I apologize, I'm sorry.
Our impact analyses are limited to changes contained in the rule itself. If the rule itself doesn't change the mandate for EBT implementation, then it just becomes one of the factors that affects all the costs. So it would not be estimated separately because it's not part of the recommendation. And it hasn't been in the past in food package rules. Regulation on EBT has been separate.
I did not estimate the retail markup, so those were without the. Just as an aside, I believe it was back in 2006. David Davis and I collaborated on a study, and we found back then that the retail markup was actually greater than the net price. So actually, for the price of formula, WIC was paying more for the retailers than they were the infant formula manufacturers.
Other questions?
So Ed, since you've done this once, regulatory impact analysis, is there anything that you would do differently if you had to do it again? Sort of a lessons learned, sort of?
I didn't describe at all the methodology, and I won't here, but I would say that the approach we took to the impact analysis for the WIC rule is one that we've tried to model and reproduce for other impact analyses. We've sort of regretted having done different analyses to a standard maybe not quite the same as the WIC rule. The WIC impact analysis benefits from the participant level prescription data that we have, which is a rich source of data that allows us to do modeling by individual prescription amount.
So you're pretty happy with what you did?
Well, I mean, the goal for us, we're happy when we get past the review process and OMB has agreed that it's a solid analysis. That's what we're looking for.
Okay, if I haven't asked you, if you haven't been asked enough time already, are there any other questions that we need to deal with today before we conclude today's session? No one is rushing the microphones. Okay. Well, this concludes a little bit early our information gathering session for phase 1 of this particular study, titled Review of the WIC Food Package. We hope that you will join us for the public comment session tomorrow, for which there will be registration at 8:30 with the program beginning at 9 in the same location. So if you'd like to come, that's where and when. And I'd like to, on behalf of the committee, thank all of our presenters. It's been a most interesting day.